Hey, how's it going? So I'm gonna do a little follow-up on my sinuplasty, uh, and then that happened over the past couple of days. Um, as you have seen on the videos, I really haven't posted anything. I don't have any videos from the day 3 on till today. So, um, like I said, day 1 and 2. Pretty difficult. Um, Very stuffy, blood coming out of my nose, dripping through the back of my throat, a lot of mouth breathing. I couldn't sleep. I did not sleep Wednesday night to like Friday. So I literally spent almost 48 hours without sleeping. One of the reasons that I found out is that my surgeon, he prescribed me some prednisone, methylprednisolone, and that's causes insomnia. I have taken it in the past for the infections that I have had, but it did not cause like this type of insomnia. And I guess also it's because I was mouth breathing. But when I started dropping, the doses, I started, calming down. So I did my own research, and what I did was Saturday I started taking melatonin, because what happens is the steroid causes a high amount of cortisol in your body, so you're in a stressing mode, and it literally just gets rid of any melatonin. So I took 3 microgram gummy of melatonin, and that helped me knock out, and I was able to have a good night's sleep. Woke up with a very dry mouth. Of course, as you can see, my my lips are a little, glossy, and that's because I've been using Aquifer. It's kind of like an ointment just to kind of help with my mouth dryness. Even though I feel a lot better, I'm still a little stuffy. So day 1, day 2, horrible. Day 3, swelling started going down a little bit. I was able to breathe a little bit through my mouth. I mean, through my nose, just a little bit. And then every single day that has passed by, it has gotten better. I have been able to sleep better. One big tip that has worked for me is I actually put a cold humidifier right next to my bed. So I got my bed set up. So mine's an adjustable bed. I was trying to sleep on my couch, but it didn't work out. So try to maintain your routine. So do the routine that you were doing before the surgery. So if you put some kind of show before you go to bed, do it. That's what kind of helped me get back at it, because this is some trauma, and it kind of throws you off a little bit, because you're not gonna feel well. You're not gonna feel comfortable the first few days, so you're like freaking out. To be honest, it's not to scare anybody, but it just a lot of things are happening inside your nose. Even though you're not bleeding, a lot of things are happening in there, healing, stress. So your body's like fight or flight mode. Um, so I took tea. Um, chum, I had the gummies. I put the TV on because I usually that background noise. I was watching like the NBA playoffs, and that has been helping me go back to like my normal. Um, Today's day 6, so today's Tuesday, and I'm kind of getting back to normal. Like I'm in my daughter's track practice. I was able to see the doctor today, and went in there for the first post-op, um, and it was nerve-wracking. The reason why is because he literally went in there. You go into the office, they put the lidocaine to numb your throat. I waited for like 15 minutes. He went back in there, and he just started scoping the nose, both nostrils, and then there's a bunch of like blood clots and stuff in the behind my septum, and a lot of crustiness in there back there, right? So I mentioned to him that I was only breathing well from one nostril. So whenever I was able to clear everything through with the washes, um, I was able to breathe only good from one. So when he went in there, he found that on this side up here, I had like a clot, like a dry clot that looked like a baby cyst, right? And he went in there and sucked it out, and as soon as that happened, I felt better. Um, but it wasn't fun. It was not fun because he had to go back, up here, because I also had the sinuplasty. So just to recap, I had the balloon sinuplasty for the chronic sinusitis. I had the turbinate reduction, and then I also had the deviated septum. So it was all three of them at the same time. But he went in there, started going all over the place, and then he got to a point where up here was really swollen, so he had to stop what he was doing, and then he put in like a gauze that had Afrin on it for another 15 minutes. Not fun. And then that swelling went down, so he came back and then started kind of sucking everything out back here. Um, and it was a relief, yeah, because it's just a lot of crustiness in there. I think that's one of the biggest things that people will suffer is the crustiness and the dryness. Right now, I feel a lot better. I can actually breathe from both, not 100%, but I can feel breathing from both nostrils. um, and the sensation, to me, I mean, I'm in Texas, so it's hot, right? So that's a good thing. The air is humid out here in the Gulf Coast, but um, it feels like if I'm breathing through, like a cold morning. It's not that pleasant, okay, breath. It has that little burning sensation when you actually, breathing something that is cold, like cold air in the morning, and you have that, that ting, like tinging sensation in your nose. That's how I feel right now. But it has improved. At the beginning, it was a lot more, and with the nasal washes, keep doing the nasal washes. When they tell you nasal washes, man, do them. I was doing them like every 2 hours on the clock. I put a timer on it, and I was going to the restroom. Use your saline solution, the neti pot. I got the little bottles. Warm them up, to look warm with the still water every 2 hours on the clock, and that kept it moist, and I was able to feel comfortable because man, that crustiness gets you really bad. It's really uncomfortable. And that's just part of the process, from what I researched and what the doctor told me. A lot of nerves have been damaged through the process, and they controlled, the moisture, the mucus in there. So it's just a work in progress. So you just gotta give it some time. But everything's looking good up there. Um, he says that he's healing. Uh, go back in about another week. So I need to go back next Tuesday, a week from today. Make sure that the stuff that he did today, like cleaning up, it has helped, and that's it. So it's it's a process. Everybody's different. This is my personal story about it. I have been suffering from this for a long time. I don't like surgery, um, but the science is incredible. My mother had the surgery like 2 or 3 years ago, and it changed her life. She's happy. She doesn't have apnea no more. She doesn't snore, and she feels more comfortable. She can walk. She can run. Like she could do a lot of things, and she's in her 60s. So it's a life changer, and I know for a fact that it will be a life changer for me. And just gotta give it some time. But like I said, pointers: be patient. Follow your routine. Take rest. Rest. Stay at home. I was able to go back to work on Sunday. Actually, I went back to work this Sunday, but I was able to, have a management position, so I was able to stay in the office, and it was nice. But if it's something really hardcore that you have to be outside all day, lift things, don't do it. And with the Afrin, if they tell you from 1 to 3 days, and you feel like you're clogged up, just don't do it. Stop using it. Use the nasal because all that constrictions and stuff like that, that's gonna build up all your clots up here. So, but I'm not a doctor. That's my personal opinion. Just continue using the rinses, and that will keep you from getting the infection. But that's all I got. I hope you guys enjoy this, and take into consideration the benefits of sinus surgery, because it could definitely change your life, and I'll definitely keep everyone posted on my progress. Have a good one.